right, are you interested in working in the healthcare sector here in the UK and you are concerned or worried you do not have a university qualification? Anyway, I am here to tell you that you can actually take up a job in the healthcare sector here in the UK without having a university degree. Yes, you heard me well. And such jobs should be able to pay your bills and make you live comfortably, fend for your family in this part of the world. Let's talk about them. So number one is this: simply take up a role of a healthcare assistant or clinical assistant. Once you become one, definitely you are good to go, because you will be working in the hospitals, yes, where you'll be supporting the nurses to do their role. Basically, you will be supporting the patients with their personal care, personal needs, and also helping the nurses. You work alongside the nurses in order to provide this healthcare support to the patient. And basically, sometimes you are allowed to do observations. What do I mean by observations? You check the temperature, you chart it down, the patient's temperature, you check the blood pressure if it is allowed, and you fill in the charts for fluid. How much water did the patient drink in a day? You fill it in. They will show you how to do this, because there's always an induction or training on how to do all this so that you won't make a mistake. And basically, you are working under the supervision of the nurses. So it's a simple job to do. And anyone can as well take up this role. You don't need a university degree to become a healthcare assistant or to become a clinical assistant here in the UK. And remember, you'll be working in the hospital environment. And I tell you what, you would love it there, because it's a fantastic and more conducive environment to work in than those working in the factories abroad. I tell you, because it's heated up, yes, the radiators are there, so you wouldn't feel cold, and it's quite nice. I've done the job and I enjoyed doing it in the past. Yes. Secondly, becoming a carer or a support worker. Yes. This is another easy one. Carers or support workers, most of them do not work in the hospitals. As a carer, you work in the nursing home, domiciliary homes, assisted living. And also as a support worker, you can be going from house to house to support your clients in their homes, because there are a lot of people here needing this special support. Some of them, they prefer to stay in their homes rather than going to live in the designated places for them, as in where government designed for old people to be staying, or people that need this special support to be staying. A lot of them, they prefer to stay in their house while you go in their homes to support them. And what do you do in their homes? You assist them with their personal needs, as in personal care. Some of them, you help them go shopping. Yes, you go out shopping with them. You spend about 1 or 2 hours out there in the mall. You shop for them. You come back home with them. You help them to make their food. You don't cook food from A to Z in this part of the country, because a lot of them here, they eat food that are already prepared, canned food, food that are halfway prepared, food that you can just put in the microwave, you warm, they eat. No big deal. And you sit down, you watch TV. I've done a job as a support worker in the past. Yeah, my role there was just to go in 10 o'clock, I sit down with my client, we watch TV. When he wants a cup of tea, he say, "Francesca, can you make me a cup of tea?" I say, "Yes, I go to the kitchen, make him a cup of tea, make for myself." We sit down together, we drink, we chat, we watch TV programs. Yes, when it is lunchtime, I go grab his lunch from the fridge, warm in the microwave for 3 minutes, serve him, and we still watch TV program, and at the end of the day, I got paid and I go home. Isn't that a simple work? I didn't have to bet him, or clean shade, but even if it requires you to do that, it's a simple role. We all do this in our homes, so nothing difficult about that. Yes, so it's a noble job to take up here without any form of degree qualification. And as time goes on, you keep getting trained in different aspects: manual handling, fire service, how to lift, how to do this and that. They provide all that training. And you know what? Their annual salary in this part of the world is about £18,000 to £24,000, depending. They have senior carers and junior carers. It depends on your level. You can also upgrade when you do training, and with experience, your level can go higher. So it's a fascinating career to take up. in this part is you becoming a medical secretary. If you are working as a medical secretary, you get assigned to senior staff, maybe consultants, doctors at the hospitals. You know, you help them with basically sort of admin role. Yeah. You make appointments, or you help them with their appointment, with their patient's appointment. You contact them, you fix it, you know, you receive their calls. So it's as simple as that. But I think this one, you might be needing to have a training in a field that is not medical, probably in admin field. You know, you need to be skilled to learn how to use the system, how to like, maybe you may previously have an experience in a call center job, you know, because you'll be talking with patients, you know, to book their appointment and all that. So definitely you are still working in the hospital setting without a degree qualification, but then you are trained for it, and the pay is still within 19,000 to 100. Sorry, and the pay is within 19,000 to 21K per annum. It's not a bad. Another kind of job you can do in this part of the world without having a degree to do it is for you to take up the job of a pharmacy assistant. Yes, you can become a pharmacy assistant by working in a pharmacy shop. You know, you are going to be doing the job of assisting a qualified pharmacist in doing their day-to-day job at the pharmacy. You know what they do. You know, basically, you do the role of you collecting prescriptions. So when you go to the pharmacy, the first person you would see there is the pharmacy assistant. That's the person that would walk up to you to collect that prescription from you. That's the paper you are holding. So once she collects it, she goes and hands it over to the pharmacist, who will do the job and then gives back to her. You know, so this is basically your job. Or when a patient or a customer comes in to ask for their prescription, you know, you ask the person the address just to confirm the prescription. You ask the person your name, your date of birth, your address, and you check it tallies with the information in the prescribed medication. You hand it over to the person. This is just your job, or to stock medication in the pharmacy shop. You are working in the healthcare sector, isn't it? And you don't need a degree for this, just a formal induction or an additional training. And do not forget that the annual salary for this role in the UK is £26,000 per annum. Oh my God, that's a lot of money. And it can increase depending on the number of experience you have had working in this very field. That's really good and attractive. Right. Another one is for you to become a phlebotomist in this part of the world. Before, I used to think that those who work in the laboratories and who collect blood samples, that they have some kind of university qualifications, though some of them might, you know, and I think when you have a university qualification, you get to earn higher than someone who do not have. So basically, you can become a phlebotomist in this part of the world without a university degree, but then you need a certificate to do it. You need a certification, you know, a kind of a formal training to do it. And I tell you what, the training costs only £100 for you to do it. £100. Oh my God. I thought it would cost a lot of money, and it's as cheap as that. And another thing to note is this: the training is just within 1 week. Is just a couple of days training. You are done and you are certified. Oh, I think it's a good one to do, to be frank. And guess what? The yearly salary is £24,000. Okay, wow, that's a good amount of money to earn, and it's not a bad one. Yeah. And what do you do? Remember, your role as a phlebotomist is to collect blood samples. That's CBC, you know, you collect samples from patients coming in for it. I think the job is quite simple, yes, because you get trained for it and you are on it straight away. Another job you can take up here without having a degree qualification is to become an emergency call handler. You know, when you call 999 or the emergency lines, somebody take up the call. Yes, they have their respondents who pick up the call to respond to you. Yes, it's another fantastic job you can take up in the healthcare sector in the UK without having a degree qualification, and it pays perfectly well. Your role is to respond to emergency calls. When somebody calls you, you respond, you ask the person the address, You can even keep the person on hold while, asking some random emergency questions. You have to be intelligent, you have to be sharp, you have to be outspoken, you have to speak clearly. And it's not when somebody is talking on the phone to you, you are saying, can you say that again? Hey, you don't know if someone is dying, you don't know if the house is going on flame. Oh my. You need to be smart, you need to be fast, you need to have a clear auditory nerves, to pick up what someone is saying in order to work in this sector. I think the interview is gonna be something else, because they must require a sharp person, especially when you don't have when you have a clear understanding of British English. If you can understand it and speak it better, I think you will be qualified for this role. Now, another fascinating job to take up in the healthcare sector here in the UK is to become ambulance paramedics. You do not need to go to university to study to become this. Yes, but guess what? You get trained, because before ever you join them, and if you pass their interview, they get to train you on the tips, the rudiments on how to handle this and handle that, because they use some facilities to aid patients once there is an emergency for it. Yes, because they also do first aid treatment. Yeah, they do CPR, CPR resuscitation if the need be in the case of emergencies. Because I had seen one on my street then. I was going to school, I just opened my door, I saw helicopter on my street. In fact, there was an accident. They were already giving the patient first aid right there at the scene of the accident. Some of them were doing resuscitation, So this is what you get trained to do. And I tell you what, you would love, you do. But you need a lot of energy yourself. You need to be an active person to take part in this, or to be employed as a paramedic. You need to be like a sport person, to work as a paramedic. But do not be afraid. They will give you all the necessary training required. And the pay is not bad, because basically they earn 24,000 to 27,000 pounds in a year. That's a lot of money. All right, so another job you can take up here without having a degree qualification is for you to become a dental assistant. Yes, I have seen a couple of them in the last month and this very month, because I was at the dentist with my child last week. Dental assistant, she came up. She was the one who prepared a place where my child was seen, So basically your role, if you are taking up this job as a dental assistant, is to help a qualified dentist in doing his job, making sure that his place of work is effectively okay. You set up the equipment, you sterilize the equipment. Maybe when they use one of the equipment to check someone's mouth, you have to sterilize it, get it ready for the next patient. Yeah, because they don't have to use it like that. And you impute data. When the dentist is looking at the teeth, that day I saw what was going on. The dental assistant was the one imputing the data into the system. They have names for all these teeth, front one, back one, this one, they have the names. So the dentist was really naming them stuff, and the lady was imputing the details into the computer. If at some point she couldn't find it, the dentist was like, scroll up, you find that missing tooth, So they support you a lot in your job. This is basically what you do. And guess what? The salary is something very attractive. It's between 21 to 24,000 pounds in a year. Yes, thousand. So it's something very attractive that you would love to do without a degree qualification. Another role you would like to take up in this country without having a degree qualification is for you to become a surgical technologist. As a surgical technologist, you work in the surgery rooms with the surgeons, the surgeons that does all the cuttings, all the operations and all them stuff. You work alongside them in the surgical rooms. What do? You provide all the facilities and tools or equipment needed for surgery. You make sure that they are okay, they are in place, before the surgery or before the surgery takes place. You've already set the place, get the facilities, get the tools ready. Oh my goodness, these people might be seeing a lot. I don't want to say what they should be seeing, especially in the case of CS. They will be seeing a lot. You need to be brave. I suppose. And meanwhile, you get trained for 2 years. So you get trained for 1 to 2 years before you can actually take up this role. Yes. So that's one thing I like about all this. In all the listed roles you can take up here in the UK without a degree qualifications, you get trained for it. And do not forget that these are surgical assistants. Their salary is 47,000 K in a year. Oh my God, it's almost equivalent to that of a nurse in this country. That's a lot of money. Most importantly, you get trained to do this job. You get to be told what to do, what to do and what not to do. Yes, so you are as good as someone who went to the university to acquire 1 degree qualification, So that's it. I hope you find this video very helpful. And if it is not for you, you can share to your loved one who is concerned or who would like to take up a job that doesn't require him or her to have a degree qualification to practice here in the UK. Thank you so much for watching. My name is Chinyere, and do not forget to like, comment, and keep coming for more. Yes, bye for now. See you again in my next content.